Unlock the future of pathology with Pathology News, your ultimate source for cutting-edge insights, expert analysis, and the latest breakthroughs in digital and computational pathology. Don't just stay informed, stay ahead.
So what I want to do now is take a step back and look at pathology from a different angle and look at the bigger picture of it. And sticking with you, Norman, what do you think will define pathology over the next few years?
I think it's very important to define what are a few years, right? Because 2 or 3 is definitely different than 5 to 6. What we will definitely see, and we see this already now, is we get a much broader adoption in the field, right? So everyone, almost all in academic institutions in Europe now have either directly or indirect access to slide scanners. Some of them are using them in routine private labs. So we see a lot of development there. Of course, it's in the still starting phase. But I think this is definitely something that we currently see, and we see this increasingly a lot in the next years. And this does not only mean the integration towards research, but definitely into routine practice, because this is the main motivation why pathology labs are adopting nowadays is to digitize the clinical workflow, not the research one. I think what we also see, and we saw some examples in the past already, is this joint development of biomarkers and algorithms, so-called computational biomarkers. I think it's also the right way to move this field, and we saw some not so good examples what happened when these things are developed independently. So I hope and I definitely see that this will increase, also because there is a lot of benefits here if you do that together and develop this together. I think we will also see some focus shift towards therapeutic guidance of computational with computational tools, not so much only the diagnostic categorization and like therapeutic proposal, but really then during the therapeutics, like guide the actual therapies. Is it working? Do we have to adjust some therapies, and so on and so forth? This is definitely getting more pace, but here we are probably talking about a longer period. In general, I see that the field is moving more and more to a streamlined version of how the digital workflow can be done. At the moment, we see it's super diverse, right? If you are looking into 5 different labs that digitized with different products, and the workflows are really quite different, yeah, and the interaction and the interfaces and everything, and I see that we also already see first harmonizations here. This is also based on some standards that are existing that require some harmonization also, but I think we will see more here in the future. Will we go to a field where, like in the automotive industry, we will be able to put ourselves in every car and just start driving, because it's literally so intuitive where the blinker is, where the steering, how all of this is done? I don't think so. It will still require some training, but we are more and more harmonizing those solutions. And this is also what is making adoption much easier in the future. So I think this will be the most important developments in the next couple of years, despite, of course, others that my fellow colleagues probably will name now.
Oh, thanks so much, Norman. And I'm looking forward to have this conversation all over again with some more people come ECDP this year. Now, going back to ECDP again, Inti, where can people find out more about not just the Congress, but the society and how to get involved in it?
So, of course, there's the website, and that's a great place to start. And I would say maybe the most important thing is to become a member, right? Become a member, especially if, as was mentioned before, if you are a resident or you are a PhD student, the memberships are free. So I think it's very nice if you will take advantage of that, because members will also get access to additional content on the website. And there you'll see so many, things. It was mentioned before, the the ESDIP Academy, which is particularly popular, right? I mean, which is for both pathologists who can learn something more about computational pathology and AI, and for the computer scientists to learn, also about pathology. So that's, for instance, something that is, an additional advantage to becoming a member. And then, of course, members will receive the newsletters. And as was mentioned, we're also going to be working on, different ways of how to, let's say, better engage with the members more in a more active way. So to see how we can really draw in members to more frequent activities that the society is doing. So stay tuned for that.
Grand, thank you so much. And finally, guys, just to wrap this up, I'd love to hear each of your thoughts on this. But what excites you most about this coming year in digital pathology? Let's start with Norman.
I could, of course, name much more, is this amazing international network that we have with our allied societies all around the world, with the Asian Society, with the African Society, with the DPA from North America, with the newly just founded LASDP. We are having the possibility to work with MICAI together. It's really great to have these groups working in the same direction from different angles and in different regions, because we can really combine forces here so effectively, that this is really amazing. And this on top of working together with not only like-minded people that have the same goal, but also with people that are really nice to work with, because they are like really amazing people. And this is true for all the people in the field, from all the societies. It's really, I think it's an amazing community. Everyone is super open to the transition, feels the spirit of the changing field, is eager to do that. And this is super exciting.
Great. And Vincenzo, moving on to you. What excites you this year?
Personally, that the field is changing, and we see it every day also in the practice. We talked about the activities that the society is carrying day by day from educational, scientific standpoint, but actually this is all meant also to help people to work better in their labs, to extract more information that we are used to do with our eyes from the slides, to stop using the microscope, because we can really gather a lot of insights from the digital replicas of our tissues, and ultimately for the patient, because I mean all this long journey is also meant to bring more precise information to the patient. As Norman said, we are seeing the rising of new AI biomarkers to predict outcomes and response to therapy. It's really amazing that we can further improve the cure of our patients, oncology and non-oncological patients. And this is something that within ESDIP we started seeing since the beginning, and we are continuing to carry all the community through this revolutionary change of the discipline. It is what amazes me most, honestly.
Great. And yes, the same question to you, Inti.
So I'm looking forward to ECDP in Graz. That I think is going to be super exciting. And I expect that we're going to see there more and more examples of the real life translation, or, the real world clinical implementation of AI. This is something that I really, really look forward to see more and more people using it and being able to share their knowledge with us. And also, I'm really looking forward to this year. And I think it's in the air, it's buzzing, as Vincenzo and Norman were mentioning. These computational biomarkers implicitly means a stronger connections with our other clinical partners, right, with our oncologist partners, and that sort of interdisciplinary discussions that are going to inevitably happen. I'm also very curious to know about where these new technologies will go, like 3D tissue imaging, because that's popping up in some pockets as being, now a very interesting new field, and seeing, how that's going to, when is that going to put its, show its impact. And also curious to know where how the AI market is going to change in the next year or 2 years, 3 years. Very, very exciting times to be in pathology for sure.
Brilliant. And lastly from me, unless anyone else has got anything else to add, thank you so much for joining Pathology News today. It's been an absolute pleasure talking to you. And I'm looking forward to seeing you all in Graz on the 15th of June when we kick off. That's all from us. Thank you very much, and take care.
Bye,
Thank you so
everybody.
much. Thanks. Bye bye.
Bye. Thank you.
See you in Graz.